It seemed like she was in pain a lot. She was very irritable. It had started to affect her eating, and a little while after, the doctor informed me she was diagnosed with sickle cell disease. I was very scared and had no idea what that would mean for her. The doctor told me that sickle cell disease was an inherited hemoglobin disorder, most likely from the other parent, which means her red blood cells are shaped into a sickle shape, resulting in them dying early and creating a shortage of healthy red blood cells. Told me that the disease causes poor perfusion and can block the flow of blood, causing pain, and the sickle cells do not flow easily through blood vessels. They are sticky and catch on one another, causing cells to pile up, which can block blood vessels and cause damage to tissues and organs.
Allie and I have been best friends since before I can even remember. I was so excited to meet her new little baby girl. I was heartbroken whenever I found out that she was diagnosed with sickle cell disease. Her journey began about a year ago when she was 6 months old. I received a call late at night from Allie. She said she was taking little Miss Kinsley to the emergency room. The last couple of days, she seemed to be in pain and more fatigued than usual. I just thought she might be teething. The nurse had noticed that she was looking rather abnormally pale. The whites of her eyes were jaundiced and her heart rate was elevated. The doctors did some blood work and noticed the presence of hemoglobin S, which led to the diagnosis of sickle cell disease. Kinsley had experienced a crisis. A crisis is a periodic episode of extensive cellular sickling. The most common sign of a crisis is pain. There are no symptoms or abnormal lab findings except hemoglobin S that indicate sickle cell disease. A patient's first crisis is usually what leads to a nurse's or doctor's awareness of the possibility of sickle cell disease.
When Kinsley came into the ER, we quickly realized that she was in sickle cell crisis, so our first priority was pain management. We made sure to give her pain medication to help, as well as removing any constricted clothing so that it didn't cause any more pain. We also extended her arms and legs as best we could to promote blood flow and gave fluids to help with the anemia and oxygen just to support her. We checked her temperature, her capillary refill, and her peripheral pulses every hour to make sure that she was recovering. So once she did recover, we had a discussion with Allie talking about how to prevent this in the future. One being making sure that Kinsley is hydrated regularly. That'll help with anemia, and because her cells are abnormally shaped, the less fluid that's in the blood, the more likely it is to get stuck on things and caught and cause pain and go into another sickle cell crisis. We also talked about as Kinsley's growing up, making sure that she understands that she shouldn't drink or smoke because this can cause an exacerbation of her disorder. She should also avoid extreme weather, such as extreme cold or extreme heat. This can also make her disease worse. She should avoid traveling to high altitude cities like Santa Fe or Denver or anything like that. And she should also avoid strenuous physical activity. Again, this is more when she gets older, to make sure that she's doing low packed exercises when she is healthy, and making sure that she understands it as she's growing up. So we just talked to Allie about that.
I'm Kinsley's hematologist. Kinsley has sickle cell disease. We started her on a prophylactic antibiotic, penicillin. I informed her mother, Allie, that her greatest risk at this young age is infection, that the spleen can work abnormally, putting Kinsley at a high risk. This treatment should continue to the age of 5 years old. I discussed with Allie it is extremely important for Kinsley to stay current on her childhood vaccinations. The goal for Kinsley is prevention of infection at this point and good pain control. She was treated with fluids when she arrived during her crisis, along with oxygen to help with perfusion. I explained that around the age of 2 years old is when the risk for stroke increases. There are options such as blood transfusions and would recommend the FDA-approved medication hydroxyurea. This drug helps with pain and changes the characteristics of the red blood cells, which helps them from sickling. The medication has been on the market for about 24 years now and has had good results with mild side effects. Allie asked if it could be cured. I told her that in certain cases, when transfusions and medications do not work in treating severe sickle cell disease, children and teenagers have had some success with bone marrow transplants from stem cells. It is dependent on the situation and if a donor can be found. It also comes with some great risks. I told her about 100,000 people in the United States have sickle cell disease, and research is ongoing. Kinsley will be followed by our multidisciplinary team here at MACC Simulation Hospital, where she will be provided the care she needs, and Allie will have the support that she needs as well.
Children with sickle cell have several different desired outcomes that we want to make sure that they meet both before and after discharge. First, we want to make sure that the child is comfortable and free of pain. Now, of course, we'll be doing this by monitoring their pain during their stay, and we'll use a modified behavioral pain scale since the child is unable to verbalize their level of pain. We also want to make sure that the child has proper perfusion and gas exchange to the extremities and organs. This will be done using constant neurovascular assessments as well as continued monitoring to assure that the organs are receiving enough blood. Finally, we do hope Kinsley remains free of infection and sepsis both before and after discharge, and we'll also be monitoring for that. It's important to assure that the patient will also be able to get enough information to both understand sickle cell and make any changes needed to their lifestyle. For this reason, we'll be providing the mother with information about sickle cell. Thankfully, the rate of survival for sickle cell is 94% in the United States, and Kinsley is expected to have a long and healthy life.